I may not be peeing all of them out. Or it's what we call hematuria. Make it blood. He would not lead the blood inside their bladder and start peeing blood.
Exactly.
Okay?
Probably.
Or it will increase the vascularity of the vessel, leading to the disruption of the vessels.
Can I ask you a question? Do you understand the relationship between how the kidney and the bladder and urethra function? Like, you understand that already?
Yeah, from what Doc said, I could...
Because
of where they are sitting.
The kidney is like a filter.
Okay.
The bladder is a tank. The urethra is a pipe.
That leads to it.
That leads the whole thing to go outside your body. So if the kidney processes urine and transfers them as waste into your bladder, it is the job of the bladder to push it to the urethra so that they go outside your body as an excretory product. But as a result of this, if there's a blockage, it's just like you built a gutter and you allowed the water, you release water from your tank, you're meant to flow through that drainage, and there's a small stone blocking it. And the water kind of like goes back to the tank.
Like reflux.
Like it creates a dam.
Is it like a reflux action? Kind of.
It's not just like reflux. It kind of like whenever, it's supposed to move forward. Mm-hmm. So it kind of like blocks it. It's like it dams it a bit. So little water will escape, some will go, while some will stay back. You understand? And because of that, once they stay back in the bladder, at a certain point, once your body will trigger itself to actually release some, and it trigger them sort of then because if, for instance, you release all the urine at once, you stay for like maybe 4 hours, 3 hours thereabout before you go and pee again. But because it has actually blocked it, you now release the amount the bladder could actually allow it through the muscles you have pushed out. The ones retained will actually get to a particular point that if the kidney drops more into the bladder, it will push them out. You understand? In that particular stage, you now find out that because you didn't push out everything in your tank, which is your bladder, it probably lead you to actually releasing them frequently, more than the regular hours you're supposed to take them. And that's just what it does. So that's prostate enlargement, that hyperplasia, kind of like forms like a dam, like it blocks it, so probably the water goes out. So that's just the relationship. If people just understand what it is, then you understand that this prostate on this one, once it happens, that's what you're going to face.
And it's good we're having this conversation, for people that are having a frequent going to water the flowers or going to spend a coin in the British adage, you have to check if something is right or something needs to be checked. So can we go into talking about something like...
Okay. Having said about the benign hyperplasia of the prostate, the third stage of it is the prostate cancer itself.
Okay.
Now, because of that cells, hyperplasia of the prostate getting wider, when it now gets to uncontrolled proliferation, meaning malignancy, it is now uncontrolled. That means it has started leaving the cells. It has started leaving the cells. It now becomes what we call adenocarcinoma. And when it's adenocarcinoma, it develops to primarily from the glandular parts of the organ. The cell now grows uncontrollable and multiply and start spreading in the surrounding of the prostate. That is when it gets now starting getting to cancerous stage, because the proliferation has now started multiplying. Okay, and we have 4 types of cancerous stage of prostate. But the tumor may even grow outside the prostate. That is the extracapillary extension, or remain localized within the prostate for decades. The question again is why these things occur. Now, the nodular cancer lesion occurs more on the peripheral zone. The peripheral zone is not too close and away, so from the urethra. So what it means that the whole the prostate itself, the malignant part of it, the proliferation has started extending far from the prostate, entering to other cells. So at that stage, you have to do proper examination. Histologically, you go to the GP, and the treatment will commence. Okay. Now, what is this? Look at the stages. We have four stages of prostate cancer. We have the normal stage. Okay. We have the stage 1. Stage 1 is still when it is undetectable. And at that stage 1, you can still treat it, and it will go. Stage 2 is it started multiplying, but it's still under the prostate gland. It has not left the prostate cell gland. It's still localized. The stage 3, it has started multiplying, leave the prostate gland, and other cells have started being affected with it. And if it's stage 2, in the Western world, it's treatable. But once it's stage 3 and stage 4, especially stage 4, maybe with that time we will not visit hospice because it has gone out of hand. Okay. Now, there was it is not approved or proven scientifically. They said because they conducted a screening test on Reverend Fathers, Catholic Reverend Fathers, because of they are not having enough sex. That most of them, 80% of them, had prostate cancer or prostate issues. So why? Allegedly, not proven. They said because you, as a man, you need to meet your wife 3 times or 4 times a week. Is it possible? Has it been proven? In a month, 21 times. I don't know how many men who will go to work and come back and still meet his wife 21 times in a month. But that is how to put this prostate at bay. To check the prostate, you have to have sex 21 times a day. People might say it's not. People might say a month. Sorry, a month.
21 times
a month. People might say it's not feasible.
It's feasible.
I don't know. I'm not. I'm getting old, so it is the young ones who tell us if it's feasible or not. But the thing is that it all started from the Catholic Church. They went for their prostate and noticed that most of them, almost 80% of the Reverend Fathers, who are not having sex, allegedly, they are not having sex. They start having prostate issues. So you need to put your prostate at work through sex. So sex is important, and that is why God created sex. So us that is men here, that is from 40 and above, we need sex. It is good, it is sweet to keep your prostate. You're saving your life. Not even if your wife, if you have issue with your wife and your wife is saying, once it's 4 o'clock, try and make peace with your wife so that in the night you have your prostate to work. Okay?
This is interesting.
Because when you don't make peace with your wife, you are killing yourself, not the woman.
So you're saying that's for the prostate cancer, but it's not for the benign.
No, for the prostate itself. I have just said that of the prostate. Yeah. But what I'm saying is, based on the cancer stage of it, once it's stage 1, it's treatable. Stage 2, 50% treatable. But stage 3, depending on the techniques, depending on the equipment here in the Western world. But once it's stage 4, it's only God can heal you through miracle.
Now, you didn't talk about BPH, how it can be treated as well. Did we skip that part, or BPH?
BPH can be treated. Yeah, once you go to the hospital, there's the essential drugs for BPH. Okay. Most of the blocks are alpha blockers medication. Alpha 1 adenoreceptors are present on prostate stroma, smooth muscles, and the neck of the bladder. Alpha 1 adenoreceptor blockage induces the relaxation of the stroma smooth muscle to improve the urinary flow. Okay, that's part of the treatment. Example is alpha 1 blockers drugs like tamoxifen and aflatoxin. Okay. Then we have another one, alpha redundance inhibition. These drugs prevent the conversion of testosterone to DHT. This is in turn prevent the further enlargement, in medical terms, and induce the shrinkage and enlarge the prostate. The drugs include finasteride and ditostride.
So yeah, I know some of the viewers may not understand this because once you go to technical, where people want to, but the most important thing is like we now know there are drugs for those thoughts to be treated, and they are quite effective, right?
Yeah.